Hi guys, for my special counseling topic presentation on a special ed classification, I did traumatic brain injury, also known as TBI, which is basically an intracranial injury that occurs when an external force damages the brain and causes some damage to brain functioning. According to the Federal Registry in 1992, traumatic brain injury is an acquired brain injury caused by external physical force resulting in total or partial functional disability or psychosocial impairment or both that affects a child's educational performance. It doesn't apply to any congenital or degenerative brain injuries, so in other words, due to birth trauma or anything like that. There are two types of head injuries under TBI. There's the open head injuries and then there's the closed head injuries. Open head injuries are also known as a penetrating head injury, and those are caused by an external force hitting the skull and damaging the brain. For example, a bullet hitting the skull and causing brain damage. Usually doesn't result in a person losing consciousness. A closed head injury, on the other hand, is when the skull is not penetrated by a foreign object. It's just caused by the brain rotating after the trauma inside the skull. So, for example, when you have like a fall or in a motor vehicle accident, and that usually causes a lot of damage to the surrounding tissue and the nerves and swelling and bleeding. Both of them have primary and secondary effects. So the primary effects basically include all of the trauma just from the damage, while a secondary is due to like the swelling, the bleeding, even hypoxia, which is when oxygen can't get to the brain, and that can lead to further damage as well as even death. Um, and then seizures are another secondary effect. The causes of TBI in children in descending order is motor vehicle accidents, then falls, then sports and recreational collisions and injuries, including bike-related injuries, then assaults. In terms of severity, the greater the extent of the severity, the poorer the outcome is for the child. And basically, it's rated on what's called a Glasgow-Coma scale, or GCS. The lower the number, the more severe it is. So a mild TBI is from a Glasgow scale of 13 or higher. And that's where just as a mental state characterized by, very little trauma, just disorientation, feeling dazed, having confusion, can't remembering what happened right before and right after the incident. Moderate TBI usually has loss of consciousness as well as cognitive and physical impairments that result, and that's rated on a GCS scale of 9 to 12. Children with severe TBI are on a GCS scale of less than 8, and you need real hypodynamic airway support. You're going to need a lot of treatment, and that's obviously characterized by a loss of consciousness. When we talk about prevalence, many people think that TBI is not a very prevalent disability, but in fact it's a major health problem in the United States. According to the Centers for Disease Control and Prevention, 1.7 million people in the United States obtain a TBI annually. In terms of children, particularly children from ages birth to 4 and adolescents from ages 15 to 19 are at greatest risk for sustaining such an injury. TBI is actually the leading cause of disability in children, with 3,000 children and adolescents dying from TBI each year, 29,000 being hospitalized, and an additional 400,000 receiving emergency care treatment each year. Males of all ages have a higher incidence of TBI than females. Other risk factors just include having a pre-injury mental illness, living in a low socioeconomic status, so dealing with being in an overcrowded household, and a disadvantaged neighborhood, high incidence of adverse life events, as well as just having a history of TBI, already have had a TBI put you at risk. There's a myth that people who sustain a brain injury earlier in life have better outcomes, but the truth is if you experience a TBI earlier in life, it tends to have poorer outcomes. When we talk about symptoms and how it affects the person, each person's injury is unique, so what's going to happen and what they're going to have occur to them is going to be different for everybody. Again, the more severe, the poorer the outcome. Sometimes you don't even see the symptoms until years later. That's pretty common. So when we talk about common just neurological physical consequences, we said seizures, severe headaches, poor sleep sensory deficits, poor motor control, so not being able to, do gross and fine motor skills, poor coordination, decreased motor speed. So it might be difficult for a student who's trying to move from class to class to get on time with the TBI. Cognitive events include memory issues, difficulty learning new information, difficulty processing, poor speech and language abilities, really difficult time with executive functionings, which is basically all of those abilities to regulate your impulses and your behavior and monitor your own behavior, and think ahead and plan your actions. So a lot of times TBI kids have a lot of hard time with problem solving and thinking before they doing, which can lead to behavioral effects like just not, having good behavior impulsivity, inattention, hyperactivity, anger control, a lot of externalizing behavior problems. It's typical of very similar to ADHD, but it's from TBI in this case. And that can cause a lot of social isolation with their peers because of those behaviors, as well as just the stigma having a disability. So that leads to the social consequences of oftentimes being seen as different and then being socially isolated. And also the TBI doesn't just affect the child, but affects the whole entire family. So the parents, the siblings, even their good friends. So like oftentimes parents feel guilt because they feel like they failed since they weren't able to protect their child from the harm that they had. They also feel like stressed because they don't know how the disability is going to progress. The whole family system has changed, which can lead to depression, anxiety, marital problems. So we need to support them and help them. They're also probably stressed because they don't know how to help the child get back and get the services they need in the educational system. They don't know how to navigate it. So we have to help the families as counselors with that. So that brings me to TBI and education. Traumatic brain injury was listed as a category under the Individuals with Disability Education Act, or IDEA, in 1991. And basically to qualify as a student with TBI under that, most states require you have medical documentation that proves the disability is impacting their education. And then they'll get what's called an individual education plan, or IEP, if they're found eligible, which will list any academic support services, behavioral services, even speech and language therapy or occupational therapy, physical therapy that the school provides that will help them be able to do well in school. At age 16, they'll get a post-secondary plan, which is basically plans for post-secondary education and employment, independent living following high school. If they're not eligible under IDEA, they might get what's services under a Section 504 plan, which would basically include like physical accommodations, assistive technology, a modified class schedule, maybe extra time on tests, things like that. The big issue we have is we want to make sure we try to keep kids with traumatic brain injury in the least restrictive environment. That's the goal of all special ed. So to have them in the general ed as much as possible. So if we can get them in the general education class with a regular gen ed teacher, that's great. Even if they have maybe a special ed teacher, that's fine. That's the goal, but if we have to do partial inclusion where they're in a self-enclosed class some of the day in some classes and then they're in the general ed class some of the time, or if they need to be, in a self-contained class, we do what's best for them. Also, other options are extended school year, which so that they don't lose important life skills from the school break, or home instruction where a teacher comes several hours a week and provides instructions to the child's home. So those are some of the options that we have. Big issue is there's a discrepancy between the amount of children out there who have traumatic brain injury and then children who are actually receiving the special ed services. So there's more children out there with traumatic brain injury who are not receiving special education services. So that's like a major, problem. When we talk about what is the implications for school counselors, what should we do? Basically, we have to make sure we're providing our interventions that are good for students with traumatic brain injury, as well as advocating for them in the education system. Harvey in 2002 outlined what's a best practice model, which basically include information of what we should do for serving children with TBI. So first of all, we should make sure we're providing meaningful and comprehensive assessments of the child and looking at what their strengths and weaknesses are so we know what services they need and what services they don't. We want to make sure we're also learning about traumatic brain injury, keeping ahead of research so we know how to best help them and understand it. Help the teachers and everybody else in the school system who's going to be working with the child understand traumatic brain injury. We want to make sure we're providing our own direct instruction, which includes individual and group counseling, to help the child really cope with having this disability and come to terms with it. We want to help the child's extended school system, which includes parents, siblings, peers. Because again, the traumatic brain injury doesn't affect the child, but their whole entire world. Also, we want to make sure we're linking them to community organizations that will help support them. When we, do reentry, that's a big process with traumatic brain injury, is helping with school reentry. Obviously, a lot of times the child is hospitalized after the incident. Usually, research proves that within a month they come back to school in most situations. But again, it depends on the severity and everything. So we have to help them so that they don't have any adjustment problems when they get back. So preparing for school entry means that beforehand we want to make sure we plan out what services would be appropriate to help the child when they come back. So maybe they'll need things like a note taker, readers, visuals aids, accessible spaces. We want to have a school reentry team that will help come up with these services. So not just the school counselors, but maybe administrator, teachers, parents, the child if it's appropriate. We also want to make sure we tell peers, and so that way we get rid of any misconceptions about the disability, and that will help hopefully make the children more accepting of this child when they come back to school. And the first week back, we want to make sure we're looking at paying attention to how the student is functioning and seeing whether those services are working or whether we need to add new services or change them or whatever. We want to do the same thing at the first month, end of the first month. Get rid of any ineffective strategies, add any new ones that we feel need be. It's important that we do this so the child feels comfortable going back to school. Also, we need to provide our own interventions, and we want to make sure that we also help teachers make sure they're doing strategies as school counselors in the classroom that will help the child with traumatic brain injury succeed academically. So behavioral supports include things like positive reinforcement, nonverbal cueing, regular verbal feedback. We want to eliminate external distractions for the child. Academic supports include things like extra test time, possibly assistive technology, breaking down the academic load, giving alternate assignments, testing accommodations, so maybe a private room. Using direct instruction is really important. Social skills is where the school counselor comes in, providing that individual counseling services as well as group counseling. Maybe we run a social skills group to help the child with the social aspects. A support group with other students who have traumatic brain injury or similar disabilities to help them teach coping skills and get that peer support. That's really important. And we also want to provide family intervention plans, so show families that are not alone and help them with dealing with this new thing where their child has such a disability. Referring them to community organizations and other support services because they also need people to help them, and getting another parent's perspective is always a good thing, and helping them to navigate and understand how to get their child the educational services, as well as just provide that moral support. So overall, what should school counselors do? I think keeping up with research on traumatic brain injury, and so that they know what services are out there to help them and understand more about the disability. Being knowledgeable is really the most important step, and then from there you can go and try to help them. But if you don't understand the disability, then it's going to be difficult to help the child. Advocating for them in school, providing those counseling services, and also helping the teachers and everybody in the school system understand the strategies and interventions that will help the child to succeed academically and socially. And then also always providing that parent support. They know their child best, so including them in the planning teams and getting them services so that they can be there to help their child is really important as well. So thank you for listening to my presentation on traumatic brain injury in the school system and how school counselors can help in that process. Have a great day.